You cannot apply the same concepts of Caucasian facial aesthetics on Asian patients, and here's why. I'm Dr. Waylon Zhang, plastic surgeon in Miami, South Florida, focusing on facial aesthetics. Asians are one of the biggest growing populations for cosmetics and plastic surgery worldwide, and there are some key differences to maintain facial harmony. Typically, Asian patients have a wider and shorter face compared to their European and Middle Eastern counterparts. So we'll typically see wider cheekbones as well as a wider lower jaw area or lower face as well. Additionally, the mid-face is flatter or more retruded. So this really affects cosmetic procedures when patients come in for Botox, filler, and injectables, as the injection points differ. First, cheek augmentation is only in the middle or central area. Because of the already wide cheeks, you don't want to inject filler in the outer area, as this will make your face even more round or square. So in contrast to a lot of ethnicities where you want more filler on the outside, the focus is actually filler injections in the middle area to provide a more full cheek appearance. Master Botox and chin filler are super popular in East Asian and Southeast Asian patients. Master Botox is injected in the lower jaw area to slim down the lower face. The muscle is typically more enlarged in Asian patients. Chin filler is also injected to help elongate the face. Now, injection points and patterns are also different among genders because a sharp and pointy, narrow chin will feminize the jaw. When the jawbone is too wide, there are also procedures that can help shave and narrow down the jawbone and chin as well. The skin and fat is also a little bit different. The skin is divided between the top layer of epidermis and the bottom layer of dermis. In Asian patients, there's typically a thinner stratum corneum, which is the very top layer of the epidermis, as well as a thicker dermis. This translates to fewer wrinkles that form, as well as actually better penetration of skincare products. Have you ever heard of Asians don't raisin? Well, there is also more fibrous attachments between the skin and the fascial supporting layer, also known as the SMAS. These fibrous attachments prevent the skin from sagging with age and also keep the deeper fat layers in place for a much longer time. But because of this, a deep plane facelift is also super beneficial in Asian patients, as this goes underneath the SMAS layer to help lift all the tissue up. Fat transfer is very popular in patients who have had weight loss or aging faces. However, there's typically very minimal fat loss in aging Asian faces. So fat transfer is typically not really needed with facial rejuvenations. Instead, the fat sags, creating a more square-like appearance. So facelifting procedures that lift up the deeper layers do a better job without the need for fat transfer. In the neck though, loose skin and muscles are still really common. So a deep plane neck lift combined with a peel or a laser are often needed to tighten up those neck bands and smooth out the skin. Let me know in the comments what you'd like to hear about next.